Welcome back to the Sexual Health Unwrapped podcast, a conversation with sexual health experts where we answer common questions about sexual health and well-being. We want to answer the questions you might be a little bit uncomfortable asking. I'm your host, Alfie. I'm a member of the Axess Sexual Health team, and today I'm joined by two guests from Axess, Dr. Jen Peters and Dr. Liz Stevens. Liz and Jen are going to be chatting with us today about all things contraception, answering key questions and busting some common myths. Liz, Jen, welcome to the podcast. How are you today?
Great, Alfie.
Yeah, good morning.
Good. I think it'd be useful for our listeners to understand your background in sexual health before we get started into some of the deeper questions. So starting with you, Jen, can you tell us a little bit about what your role in sexual healthcare involves?
Of course. So I'm a GP. So I spend part of my week working in a surgery in Liverpool, and then the other half of the week I spend working with yourselves at Axess. And, you know, it's such a lovely team to work with. Really, really enjoy being part of the sexual health team.
Fabulous. And Liz, would you be happy to tell us a little bit about the work that you do in sexual health?
Yeah, so I'm a consultant in community sexual and reproductive health, which means that we specialise in providing all aspects of reproductive health care, like contraception, as well as sexual health.
Fabulous. So you've come on the podcast today to talk with us about contraception. So just to kick things off, Jen, can I ask you to give us sort of a broad overview of the contraceptive options that are currently available?
Absolutely, yes. So we have a full range of contraceptive options available, and obviously at Axess we offer all of them. So they range from things that rely on the person having to use them, so things like condoms, caps, we've got pills, we've got patches, we've got rings, we've got injections, obviously, that we administer, or there is an option that patients can self-administer. And we also have more longer-term options that we like to think of as we fit and forget them. So things like the contraceptive implant, and we've got intrauterine devices, or coils as they're more commonly known, devices that live inside the uterus or womb, and these can last for many years.
So people can access these contraceptive options through our sexual health service?
Absolutely. They can come to us here at Axess. There are some options that they can access via their GP, certainly pharmacy as well. And of course, there's options available online as well. So really, in terms of access, there's loads of different options, and it's totally up to patients, you know, where they feel comfortable going, where they want to get these things from.
Yep, there's. I can totally agree that there's so many different pathways for people to get their useful contraception, and it kind of brings me on to my next question, which there's a lot of contraceptive options to choose from. When we, as I say, there's so many different pathways that people can access them. So, Liz, what advice would you give to someone who doesn't know which contraceptive method to choose?
Yeah, I think it's just really, really, really important to tailor it to the individual. So, you know, we just spent a bit more time finding out a bit more about the individual, any medical problems, which might mean that it might rule out certain methods, whether they've used anything before and how they've got on with it, and kind of what their preferences are and where they're up to in their own reproductive life. So whether they're, you know, pregnancy's off the agenda for quite a long time, or they might be planning pregnancy in the next year or two, or may have just had a baby. Yeah. So there's lots of different factors that might influence choice.
Absolutely. And I guess other things that may be a problem to them, things like heavy periods, painful periods, you know, there's lots of additional bonuses other than just stopping you getting pregnant.
So if someone's tried a contraceptive method that didn't work for them, what advice would you give them for trying a different method?
Come back and talk to us. Absolutely.
Yeah. And again, I think we just spent a bit more time finding out what were the issues, why didn't it work, what was the problem. Sometimes people can have side effects in the first month or two, and actually if they're able to sit with it for a little bit longer, they'll settle down and they might be fine on the method longer term. But, you know, as we've touched on already, there's lots of different options. So come back, we can look at it, we can talk through and maybe see if a different option might work better for you.
Yeah, because people's experiences of sexual healthcare is very individual, very unique. Yeah. So, you know, just because one option didn't work for you, another might work very well.
Absolutely.
So we know what contraceptive options are available, but we also know that a barrier to accessing contraception is concerns about whether or not it will impact people's health. And there's a lot of misinformation online. So I wanted to give you both the opportunity to talk through some common myths about contraception that you'd like to challenge or dispel.
Thank you. Really, really appreciate the opportunity to do that, because we're so well aware, aren't we, of how many different myths are out there, and it's a real shame if that puts somebody off a method which could otherwise have suited them really well. So, any you wanted to pick up on, Jan?
Yeah. Well, I agree. I think people are so heavily influenced now by what they see and read online and social media. You know yourself, you're going to pick a restaurant, you're going to pick a hotel. You see one negative review and it really does, impact your thought on that, doesn't it? I guess the biggest myth that I would love to dispel is that hormones are bad. The additional hormones are not good for you. And I read a term the other day when I was reading an article, and it was hormonophobia. And I quite like
brilliant.
that. This real worry about having extra hormones. I mean, we're full of hormones, aren't we? So many hormones are at play in our body, and there can be real advantages of kind of topping up those hormones or giving additional hormones. So yeah, I guess that's what we really want to talk through today, isn't it? Just to allay some of those fears and anxieties that people may have about using hormonal contraception.
Yeah, another term I've picked up on is hormone hesitancy. People are really hesitant about using hormones. And again, I think it's just about really just making sure someone's fully informed with the facts so that they can then make the decision about whether it's the right option for them or not.
Yeah, because as I say, there's so much misinformation online, and I agree with you, Jen, that it's no one's kind of fault for digesting that misinformation. I think we all do it in different ways. Yeah, we all take the information that we see online, and sometimes we don't challenge it because it comes at you so fast. So I think it's important to sit down and kind of go through some of the common questions and concerns people have about their healthcare when it comes to contraception.
Yeah.
I think, sorry to Alfie, but the reason why we're just so keen to sort of dispel some of those myths is that what we're really seeing now is it's translating into a rise in abortion rates for women who have had unplanned or unexpected pregnancies. And the stats are showing that more and more women going for abortion have either been using no method at all or relying on the fertility apps, which I think we'll probably come to, won't we? And I just don't think that I just think it's really important that we make women aware of the different effectiveness of different methods.
Absolutely. And you have to remember, online there's real negativity bias, isn't there?
Yeah.
People are much more likely to report something that hasn't suited them or hasn't worked out for them, rather than the vast majority of people who actually get on really well and are fine with these things. Absolutely.
So that brings me on to a couple of questions that I think are quite commonly proposed about contraception, people's concerns. So a concern that we hear often is that contraception can affect long-term fertility. Liz, is there any circumstance where someone may have to worry about this?
So I get a really good question. Really, really, really important to reassure women that practically every method is instantly reversible. So as soon as you stop it, or as soon as it's removed, if it's an implant or an intrauterine device, a coil, the effect is gone immediately. The only method where there is a delay in return to fertility is the injection, the contraceptive injection. And on average, it takes about 6 months from when the injection has run out for the effect on fertility to come back to normal. So there's no long-term, like forever effect on your fertility. It just takes a bit longer for it to come back to normal.
Absolutely. And that's not the case for everybody, is it?
No,
that's what
definitely not.
For people, I think they say something like 99% of women within 3 months of stopping their contraception, maybe with the exception of the injection, will have returned to periods, normal cycles, or have got pregnant. So we can really reassure women that isn't something they should be worrying about.
Yeah. So you spoke earlier about long-acting contraceptive methods as well. So I think it's important to talk about these methods because they are extremely effective, and but again, people do have different sort of thought processes about getting onto long-acting reversible contraception. So, Jen, could you explain in a bit more detail what long-acting reversible contraception, or LARC, is, and what the LARC options are that are available to patients?
Yeah, absolutely. So as we said, long-acting reversible contraception does what it says on the tin. It works for a long time. It's reversible, so as soon as we remove it, as we've said, fertility will resume. And we have quite a few different options. So we have the contraceptive implant, which is a little implant that lives just underneath the skin of the upper arm. That lasts for 3 years, and it works because it's constantly releasing the progesterone hormone. We also have the intrauterine devices or coils, and we have 2 different types of those. We have the copper coils, and they are hormone free. So with those, you would carry on having your normal cycle, whatever is normal for you. There is a chance for some women that periods can get a bit heavier and more painful. Not always the case, but we do have to counsel women that that's a possibility, and they can last for either 5 or 10 years. And then we also have a hormonal coil, and again, that constantly releases a very, very low dose, low level progesterone hormone, and that works to keep the womb lining thin. And we have options for 3 years, 5 years, or 8 years. And often they can have real additional benefits because for most women, their bleeding will lighten, and for some, it might stop altogether. So really useful treatment for heavy, painful, problematic periods too.
And I think that touches on what Jen mentioned before about, there can be really good additional benefits of the method, not just preventing pregnancy. So something like the hormonal coil can make a massive impact on a woman's life if she's really suffering from problematic periods, say.
So it sounds like there's lots of benefits to long-acting reversible contraception. I think some people worry that fitting an implant or a coil will hurt, or might be a little bit uncomfortable. What would you say to someone who is nervous about the procedure to receive an implant or a coil?
So I think this is something we are really passionate about, really passionate about. We're all about trying to make a procedure as comfortable as possible. With the implant, it takes less than a minute, and it's always done with or offered with local anaesthetic. So yes, you might feel a sharp scratch and a bit of a sting as the anaesthetic goes in, but then the skin is numb and you shouldn't feel the implant go in. So I think most people feel okay about that. The main myth is around the coil and or the main challenges around the coil that, people might have had really awful experiences from others and that might have put them off. So as I say, in our service, we're all about making it as comfortable as possible. So as well as telling somebody to eat something before they come and take some painkillers, we also offer local anaesthetic for the procedure itself, and that can make a massive difference. I'm not going to lie though, it may not be pain-free. So an individual person's experience can vary hugely. Some people don't feel it at all, and others at the other end of the extreme really can. And most are somewhere in between, wouldn't you say? But there's no doubt that the local can make a big difference.
Yeah, and absolutely we get it. We get people are worried and they feel nervous and anxious, and we all, I think, do our best to try and allay those fears. We're very good at chatting rubbish to you, distracting you. We can talk about anything. And as Liz says, the vast majority of women are absolutely fine having the device fitted.
And we always have an assistant with us for the coil fitting procedure, who, as well as just monitoring and making sure that the woman is feeling okay during the procedure, very good at hand holding and reassuring somebody as well.
Absolutely.
Yeah, I think this is something that I spoke about with Dr. Martin Wood in our previous episode about people coming to Axess Sexual Health. Where, the experience of coming to a clinic can be quite daunting, I think.
Totally, yeah.
But I think it's really useful on this podcast, on this platform, to talk about how we're a caring service. We understand, a very empathetic service, I would say, and that really understands what that experience is like, because it's your day in, day out bread and butter. You're experiencing people's feelings about coming to the clinic all the time, and we know what it feels like, and we're here to hold your hand and help you through the process.
Absolutely, yeah.
So another worry that people also have about long-acting contraception is that their coil or implant can move or come out of place. Is this a possibility?
So with the intrauterine device or the coil, that is one of the things that we counsel people about before we fit it. We do know there are risks associated with anything that we do, and expulsion or the coil coming out, it is a risk. So we do let women know about that. It's not common, but we teach our patients to know how to recognise that, how to do things like checking their threads to make sure they feel the right length, and if there's any changes there or any new symptoms, we prompt them to come back. So yes, coils can fall out, but it's not common. What's even totally even less common is for something called perforation, where the coil makes a small hole in the womb lining and goes up into the abdomen. You know, we're talking 1 to 2 in 1,000. These are really, really low risk things.
Sorry, just to talk about the implants as well then. So a correctly sited implant should not move at all. It will just sit under the skin in the arm, just here. So the vast majority are correctly sited. Very, very, very rarely they might be inserted a bit deep and be in a muscle. And when the muscle contracts, that can make the implant move. So it can migrate a little bit like that. And there's very, 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 very extremely rare reports of where it's been inserted into a vessel and it can travel around and lodge in the lung in that situation. But it's, you know, only a handful of cases of that when you think about the thousands of implants that are fitted.
I think it would be quite reassuring for listeners to hear that these instances are a rarity, but in that small rarity chance, you are supported through it, you are counselled through it. Yeah. The support is always going to be there.
And it's so important that, you know, we cover all of this with the individual before we go ahead and fit it, you know, so that they are fully informed. And we mention all of these risks that we've just talked about.
Yeah.
And what to do if you're worried.
Yeah.
And we've got very much an open door policy, haven't we, as well, in our service, that if somebody is having issues, they're worried, then we will always see them. So they know that they can come back at any point with concerns.
Yeah. I think that's a real strength of sexual health services.
Yeah.
And I think working in sexual health, we, as you mentioned earlier, we do hear about people's concerns about hormonal contraception. So some people are concerned about hormonal contraception causing mood changes or weight gain. What would you advise about this?
So it's a really difficult question to answer yes or no, because basically there's no concrete evidence to tell us either way. I guess, you know, things like mood, weight gain, so many things at play there. You know, we can't just attribute one thing to another on the whole. You know, lots of psychological, social factors that go into both of those things. The only method that has been shown that there is a possibility of weight gain is the injection. And there are a couple of groups that we think that weight gain is more common in, and that would be our younger women, so under 18, who are already overweight at the time of starting the injection. So if their BMI is 30 or over and then they receive the injection, they might be more likely to put on weight, or people who've put on more than 5% of body weight within the first 6 months. That cohort might continue to put weight on. But again, the vast majority of people using the injection don't put weight on. And with all the other methods, there's no kind of concrete evidence to prove or show that they cause weight gain. And in fact, some people report they lose weight and using methods.
Yeah, and some people report that actually their mood improves. So the other thing I talk about is, you know, in a natural cycle where you're not on any hormonal contraception at all, you know, I think most women would identify that their mood might change during the course of that cycle. And our weight fluctuates as well. And the evidence shows that that's no more or less likely with most of the methods, apart from what Jen's described with the injection. Yeah.
And actually for women who struggle with some mood conditions like PMS, PMDD, using hormonal contraception really improves things to kind of stabilise those hormones throughout the month is actually really beneficial for them.
Can be a benefit.
They feel better using those hormones.
So in addition to hormonal and weight changes, which you've answered questions about, some LARC options can change a user's bleeding pattern. And people might worry about this change or feel that it's not natural. What would you say to someone who's worried about how their bleed pattern might change?
I think a really common concern is about not bleeding and what's happening to the blood if it's not coming out. And so that's a really great question just to clear up. I think how I try to explain it is that, you know, when you have a period, it's the lining of your uterus breaks down and comes away. When you're on these methods where you don't bleed, it's literally just that it stopped that build-up of the lining of the uterus, so there is nothing there to come away, and that's why you don't bleed.
Yeah, absolutely. It's not building up inside.
No, it's not building up inside you, that's right.
to come away.
Yeah. And I think most women feel reassured by that. So that's about no bleeding at all. But there's no doubt with the implant, for example, that it's very random what can happen to your bleeding pattern with that. Really important that we do talk to women about that before they have it fitted. And for some, they can get really quite irregular, unpredictable bleeding, and that can be a real problem and a nuisance. So, you know, with that, again, we say we've got an open door, come back in if you're experiencing that, because there are things we can do to help settle it down.
So if someone feels a little bit distressed about how their bleeding patterns change, they can come into clinic and speak with a doctor or a clinician.
Absolutely, because like you say, there's options we can use to help with that.
Yeah, really important. Don't just suffer. Don't put up with it. Come back in.
Yeah, I think that's really useful to hear.
Yeah.
And also another concern that I have heard expressed in the past is that there's a link. People have heard that there's a link between hormonal contraception and cancer. What would you say to that? Can you dispel that?
Okay. So we do know with all our hormones, whether they be hormonal contraception or hormones that are used in hormone replacement therapy, all of those do carry a very small increased risk of breast cancer. And when you look at the stats, it's teeny tiny. You know, this really shouldn't be a reason for the vast majority of people to stop them using that method. So very, very small increased risk. And I will always tell my patients, just be breast aware, you know, checking the boobs once a month in the shower, reporting any changes. But actually, a lot of the hormonal contraceptives are protective against some cancers as well. So as everything, it's a balance, isn't it? So protective against ovarian cancer, endometrial or womb cancer. So yeah, it's having that individualised discussion, but the risk of breast cancer is very, very small, and there's lots of other things that would put your risk up higher, things like being very overweight or drinking lots of alcohol.
And again, that's why it's really important to tailor it to the individual, you know. So like Jan said, most women, it won't be that much of an issue. But absolutely, if you've got a strong history in your family of breast cancer, say with your mum or aunties, then that is going to be an issue, and you'll want to discuss it and explore it further, and that might influence your choice.
Yeah.
Well, that's really interesting. I think we've covered a lot and answered a lot of anxieties that people might have about contraception, long-acting or otherwise. You mentioned earlier about fertility apps. Do you have any concerns about fertility apps? Something you mentioned?
Definitely.
I mean, I think, you know, what has been absolutely brilliant is that previously when you asked somebody when was their last period, nobody knew. They couldn't remember at all. Now they can tell you exactly, and they can give you really accurate data of their cycle and their cycle length. And that's actually really, really helpful. So I think just in terms of tracking your cycle and getting to know your own cycle better is a really good thing. But I think that what isn't a really good thing is relying on it for contraception, because it's just not effective enough. Especially if pregnancy would be a disaster for you.
Yeah. And there's lots to it, isn't there, with fertility awareness? It's not just tracking your cycles. It's things like being able to identify changes in your discharge, checking your temperature. You know, it's quite involved. And for most people who lead busy lives, actually, pick something that's easier, you know.
So you would advise someone to come in and talk with you guys?
Yeah, definitely. And often when we have that conversation and sort of explore, well, okay, how much of a disaster would it be to get pregnant right now? And what's sort of influencing your sort of your preference to use the fertility app? It may well be that they prefer a non-hormonal method, but when we've talked a bit more about the copper IUD and it not having any hormone in, but it being really highly effective, long-acting, reversible, a lot of women then make that choice to have a copper IUD instead.
Well, I think
as an example.
Yeah. And whilst we're on the topic of that, sorry to interrupt you.
We're on a roll.
We see a lot of people coming in using what we call the withdrawal method.
Yes, definitely.
So it doesn't come. So it's fine. We know that there can be sperm in the pre-ejaculate. So we would absolutely not advocate using withdrawal methods as a method of contraception. And I think sometimes that comes as news to a lot of patients that actually that isn't reliable.
So with regards to hormonal contraception as well, people do have a worry that it might affect their libido. What would you say to someone who's worried about how their libido might change?
So again, libido is one of these really difficult things to ascertain, cause, and there's so many factors at play when we think about libido. There is, again, no concrete evidence that hormonal contraception can affect libido. Some women anecdotally will find it gets better. Some women will find it get worse. The vast majority probably won't notice any difference at all. Of course, with some progestogen-only methods, people might notice a bit of vaginal dryness, so that might impact libido. But equally, if you're on a method that improves your periods, so you're not struggling with heavy awful periods anymore, your mood's better, your libido might be great.
And you're no longer worried about pregnancy.
And you're no longer worried about pregnancy.
Yeah.
So very hard to establish cause and effect with these things, but yeah, no concrete evidence.
But again, I know we keep saying it, but, come back in, let's discuss it. We can explore it in a bit more detail and also explore whether there are other factors that might be influencing the libido, not just the contraception. And that's where Axess Sexual Health is so fabulous, because we've also got a sexual problems service that, if needed to, we might be able to refer somebody into that.
Absolutely. And that brings me quite nicely onto my next question, because I think we've explained quite well the options that are available and the service that we provide and how we're a non-judgmental and very welcoming service. But I think some of our service users may still worry about confidentiality, particularly around the use of contraception. Could you talk us through a little bit about the confidentiality that Axess provides for people who are looking to utilise the contraceptive offer?
Yeah.
So we are a confidential service, but there's a caveat to that, which I'll explain. I think a lot of people come in and they kind of expect that you'll be able to see their GP records, so we do explain, no, ours is a standalone system. We can't see their GP records, and equally the GP can't see their records in Axess. And I think that's really important. So, we'd say, look, it is a confidential service. We don't share any information that you've shared with us in the room today, unless you ask us to, or unless if we were particularly worried about their safety. But we would always discuss that with them first.
Yeah, absolutely. And just saying, we are a safe space. And if you are struggling with domestic abuse or issues in a relationship or anything, we can try our best to help with that. So, yeah.
Sometimes we always we would always ask permission first, but if someone's had a LARC method fitted, like the coil or the implant, then it's really good practice to let the GP know so it's on their records. So there are a few medications that can interact with the implants, so it's good for it to be on their GP medical records so that would bring up an alert. But always we'd ask the patient first, is that okay if we send them a letter? And then also the consultants in our service provide like a specialist complex medical problems service for contraception. So that might be where we might ask if we could communicate with their specialist if they've got a complex medical problem, so we can advise safely on best method of contraception.
So a young person coming to our service who's worried about maybe their family or finding out about their contraceptive usage, that's not something that they have to worry about.
Absolutely not. Yeah.
Fabulous. Well, I think we've covered a lot of ground, and I think we've answered a lot of questions that people may well be anxious about and may well be questioning before they come into clinic. So I think this should be a really useful episode for our listeners. So Jen, Liz, thank you so much for joining us today. You've been really helpful. And I think you'll have really helped to clarify some concerns.
Hope so.
Yeah.
If you'd like to use contraceptive services, you can find out all about the services we provide at www.axess.clinic. You can view our clinic opening times and use our online booking platform to organise an appointment in our clinics. You can also find useful information and guidance on contraception. Thank you, and we'll see you next time.